So now we have the passageway. The passageway is also known as the birth canal. You have the bony pelvis, the soft tissue of the cervix, the pelvic floor, vagina, and then you have the external opening of the vagina or to the vagina. So when we're talking about the bony pelvis, we can actually go back to chapter 3. There are some different types of pelvises that play an important role in a woman's delivery. If you have a woman and she has a gynecoid pelvis, this is the classic female shape of a pelvis, normal female. But if I have a pelvis which has been determined through assessment that is a platyploid, this is a flat type pelvis, so that's not going to be so favorable as far as in terms of delivery. There is a nice chart comparison or comparing the pelvic types on page 349 in your textbook. Most women have the gynecoid and it's round in terms of if you were looking at it in terms of a shape, whereas you can see the other shapes are a little more difficult to actually have a baby pass through. So there's a nice comparison where it gives you kind of the shape. You can see android is a heart shape, anthropoid is more oval, and the platypoid is flat itself. So what you're looking at is a picture from your textbook. It's a picture of the uterus in normal labor. You can see that the top portion in picture A, this line is just the first stage of labor, where here, down here at B, we're looking at the second stage of labor. We'll talk more here shortly about the different stages of labor and what that means, because that plays an important role in the mother-baby world as far as testing goes in NCLEX. Some of the things that you do need to know is there are powers, primary and secondary powers, that are very important into the actual labor process. So you have an involuntary and voluntary powers that are combined to expel the fetus and the placenta from the uterus. So the involuntary portion is uterine contractions. They're called primary. Then what happens is once the cervix starts to dilate, voluntarily or voluntary bearing down efforts by the woman is called a secondary power. This augments the force of the involuntary contractions. So we had talked about a couple of weeks ago that there were 3 terms in describing contractions that are important. The first one is frequency. Frequency is the time from the beginning of one contraction to the beginning of the next. Frequency is the time from the beginning of one contraction to the beginning of the next. Duration is the length of the contraction. Duration, length of the contraction. Intensity is the strength of the contraction at the peak. Intensity is the strength of the contraction at the peak. So with primary factors, primary powers, are responsible for that term effacement and dilation of the cervix, which ends up playing an important role in the birth of the baby. So effacement is that shortening and thinning of the cervix. This happens in the first stage of labor, usually about 2 to 3 centimeters long and 1 inch thick is normally the cervix. So as we start to have effacement, it's expressed in percentage, 0% to 100%. So as that thinning starts to occur, it's given a percent number. Dilation of the cervix is the enlargement or widening of the cervical opening. So when we're talking about cervical opening, we're talking about this down here. The cervical canal that occurs once labor has begun, what happens is the diameter increases from less than a centimeter to full dilation, which is 10 centimeters. This is the part where if you did the simulation over the summer, I think of 1 to 2 centimeters, the size of a grape, where full dilation, 10 centimeters, is about a navel orange. So you can see that's really not a big size for a baby to pass through. So this is part of why we have the fontanelles and the molding and the actual rotation of the baby. So now we're actually going to talk about the process of labor. So when I talk about the process of labor, this is the actual moving of the fetus, placenta, and membranes out of the uterus through the birth canal. So signs of preceding labor. Uterus sinks down and forward about 2 weeks before term. Remember, term is 40 weeks gestation. When the presenting part, which is usually the baby's head, descends into the true pelvis, what will happen sometimes is this is called dropping or lightening, and this happens gradually. This is where the women will start to feel less congested. They can breathe a little better because they've gotten that pressure taken off their upper respiratory system, and now the pressure has moved down, so the pressure's on their bladder, so they're having a lot more urinary frequency. Those are the moms who have to pee every 5 minutes. So this is part of what's happening and why that's happening. Now, if you have a multipara woman, so you have someone who's been pregnant multiple times, the lightening may not actually take place until she's actually started uterine contractions. There is a box on page 351, box 13-1, signs of preceding labor. These are some of the things that we're actually going to get ready to talk about. However, they're just in that box if you want to refer to them quicker. So the woman may complain of low back pain. She may also feel the irregular, frequent, and strong Braxton Hicks. Remember, these are not true labor. They're irregular, they're painless, they may be frequent and strong, but irregular and painless. The other thing that happens is moms will have something that's past called a bloody show. This is the brownish or blood-tinged cervical mucus that starts to ooze out from the vaginal membranes. The other thing that happens is usually days before labor starts to occur, moms will lose about 0.5 to 1.5 kilograms in weight. This is from water loss. This is also where we have the electrolyte shifting around. So this is produced by the changes in the estrogen and progesterone in the body. The other thing that happens is she has a surge of energy. This is where the moms are like going around, they're cleaning their house, they're like feeling great. So that will occur too. Now we're going to talk about the stages of labor. So what happens in the course of a labor in a woman without complications and the fetus is in a vertex head down position? This is what should occur. Regular progression of uterine contractions, effacement and progression in dilation of the cervix, and progress in the descent of the presenting part. Now, we will find out later in a couple of chapters down that that doesn't always occur nice and smoothly. But we're going to talk about the normal part. So when we talk about the stages of labor, there's the first stage of labor. This lasts from the onset of regular uterine contractions to full dilation of the cervix. The first stage is much longer than the second and third combined. It is also divided into 3 phases. They are the latent phase, the active phase, and the transition phase. This is important information that you guys are going to have together for for testing purposes, for NCLEX purposes, and for taking care of your patients on mother-baby. So, what happens in the latent phase? There is more progress in effacement and of the cervix, but there's little increase in the actual descent. With the active phase and the transition phase, there's more rapid dilation of the cervix and an increased rate in the descent. We also have the second stage of labor. This is the time the cervix is fully dilated to the birth of the fetus. It also has two phases, latent phase and active phase, which is active pushing. So during the latent phase in the second stage, this is where the fetus continues to descend passively through the birth canal and starts to rotate in an anterior position. During the active pushing phase, this is where the woman has the strong urge to bear down as the presenting part of the baby starts to descend and presses on those receptors that stretch at the bottom of the pelvic floor. The third stage of labor lasts from the birth of the fetus until the placenta is delivered. Usually, the placenta separates after about 3 or 4 strong uterine contractions and is delivered. The fourth stage of labor is actually 2 hours after the delivery of the placenta. This is that immediate recovery place where homeostasis is reestablished. This is where it's a good time to promote bonding, attachment, and breastfeeding, and also monitoring to make sure there's no abnormal bleeding from mom. This is the pictures of the mechanism of labor. There are 7 cardinal movements, and the wording did not come up on yours. They are in your textbook. Page 351, paragraph says mechanism of labor. 7 cardinal movements are engagement, descent, flexion, internal rotation, extension, external rotation, and then finally birth by expulsion. These movements are discussed separately, but they actually work in a combination simultaneously together. These are important because this is the baby actually rotating internally before the baby is born. So with the mechanisms of labor, we will review them, but in class it goes to tell you the different descriptions of descent versus flexion, internal rotation, starting on page 352 over to 353. So you have fetal adaptation to delivery. We are going to hold off on that little part on page 353 for right now because I want to talk about all of mom and the labor and the delivery process, and then when we start to talk about baby, I'm going to pick up from fetal adaptation all the way through newborn assessment and complications with baby. So I like to talk about newborn together and try to stay as consistent with mom's first and then do it that way.